It's the announcement we were all fearing.
As a result of further work by our incredible tracing team, there are other cases.
One of them, a member of a band that had travelled extensively.
The band is called Nothing Too Serious. I wouldn't say it's exactly how we feel because it obviously is serious.
As a result, increased testing has been set up, not just for people who visited the Avalon RSL and Kirribilli Club, but also the Penrith RSL on the opposite edge of Greater Sydney.
Our working hypothesis is that someone at that RSL club was potentially the source of infection for a number of subsequent cases.
I've been to quite a few of the reported locations. Someone in my street tested positive.
The government has urged all residents to get tested if they feel any symptoms, and locals have wasted little time. Another positive case is confirmed to work at the Pittwater Palms Retirement Village, prompting New South Wales Health to direct aged care facilities in the Northern Beaches area to lock down.
We're recommending no visitors until we identify the source of the infection and feel more confident that we have it under control.
The PM's feeling confident too.
To be honest, New South Wales is the gold standard, so I don't spend too much time worrying about New South Wales.
So have we learned enough to stop this new outbreak in its tracks?
Tony Blakely is an epidemiologist and public health specialist, and he joins us now. So, Tony, the numbers are really expanding quite rapidly. Can we contain this?
Well, who knows? But they would expand rapidly because we've started all that testing. And so based on those first two cases, you can test, and you'll find ones out there. The real truth will come through in the next couple of days. But this is serious.
We've seen WA Act already reimposing self-quarantine for people from New South Wales that are heading there. Do you think it's something that other states, given the way they behaved in the past, particularly Queensland, are going to be looking at? Are we going to see border restrictions return?
I fear we might. Queensland has already said that anybody coming from this area has to basically keep away, and that they're not to go into rest homes, prisons and one other environment that I've lost track of, sorry. So Queensland's already starting to act and they may escalate that. I think a bigger concern is making sure that the rest of Sydney doesn't have exposure. So this lockdown that they're doing at the moment, or stay-at-home order, needs to be complete and really quite tight to contain this, because the infection could well be ahead. The other thing is, really, for New South Wales, get your masks on, because if everybody else gets their masks on, it's going to dampen the spread elsewhere. As far as other states in New Zealand, we'll see what happens in the next 24 hours, but I suggest it might be quite busy on media announcements.
Tony, it doesn't sound like much of a lockdown at all. Residents from the Spit Bridge up to Palm Beach in the north are just being told to stay at home and encouraged not to head outside to various workplaces and gyms. But they're not being given actual orders. Is that going to be enough to contain this outbreak?
Look, I'm not on the ground. However, I would have thought you'd be acting quite fast, perhaps not as aggressively as they did in South Australia based on false information. But from Sydney's own interest, you don't want this getting back into the main part of Sydney and spreading out to west and southern Sydney. So I would have thought that going very hard now was the way to approach it, and getting masks on everybody in Sydney at least, because if it gets out, you want to dampen that spread.
Why 3 days? What would that achieve?
3 days is not enough. 3 days is purely a holding pattern in my view. It's basically saying, stay at home and we'll reassess. Now, I think it's very likely that that will continue beyond 3 days. I can't see 17 not going up further. There's going to be more cases found in the next 24 hours. I suspect it's looking like a week or more for the northern suburbs.
Tony, we heard the Prime Minister say he doesn't spend much time at all worrying about New South Wales. That might be about to change. Gold standard is almost the slogan of New South Wales Health. Is this their biggest challenge?
Well, I thought Scott Morrison might live to regret that, but we'll see. New South Wales has done very well, but the rest of the states, well, Victoria, because they're the ones that have been stressed, have lifted up to that standard at least. But New South Wales wasn't severely tested as it was bubbling along at about 10 cases per day. They never really had it in a rest home setting or some complex setting. Now, hopefully it doesn't get into the rest home care setting here, but New South Wales is going to be tested by this, and I wish them the best of luck, and there is always a bit of luck with COVID.
Tony, the last time I was on this show, there was concern about a worker who had contracted COVID from quarantine. Do you think New South Wales has been lucky and this is, as you say, the test, but we've become complacent?
Yeah, to some extent, I think that is what's happening here. Time will tell. But what would have happened here is that somehow this virus has gone to those northern suburbs and most likely through somebody in quarantine, passing it on to somebody. So that genomic testing that we're about to hear back on any minute now will be useful because it will identify which of the, say, 50-odd people in quarantine that it came from, try and isolate it, and then they can put more contact testing on the possible chains of communication there and try and mop it up. So that genomic testing is going to be really important to try and stamp this out quickly.
Tony, I feel like at times like this, expectations matter. Like the numbers that we see come through in the next couple of days, if they match our expectations, we don't freak out. If we don't know what to expect, then we do freak out. Can you give us any guidance? Like what sort of numbers that we might see over the next couple of days to be expected and not necessarily a problem?
Okay, so basically what you're asking me is what would freak me out? What would freak me out is, say, more than 40 cases by the next 48 hours. Less than that, I think, is okay because there's going to be more. When you found another 12 today, and there must be a whole lot of tests at the lab now being tested, so you're going to find more tomorrow. So if it goes more than 40 within the next 48 hours, then I'll be starting to get worried. OK, that's very useful information, and you asked that question far better than me. So you're a professional all round, Tony. Thank you very much for your expertise tonight. We really appreciate it. Pleasure.
Lisa and Liz, I guess we throw to you. This is your pad.
Well, it's interesting. I flew today from Ballina in northern New South Wales into Sydney, and the flight was full and mask wearers were in a minority. So I feel like that complacency has started to creep in within New South Wales, and it's scary.
And I think Tony's right. I think the Prime Minister will live to regret that statement about he never worries about New South Wales. We've had many conversations on this show about that very fact, that in New South Wales, because we never went through what Victoria did or South Australia, we weren't in the bubble like Queensland and WA, and we've just been sort of rolling along thinking, gee, haven't we done well? Well, it turns out it's still out there. Mm-hmm. It's very definitely still out there, and it's obviously people who are asymptomatic that are passing it around that we're not aware of. This is, you know, such a reminder of we are in a pandemic and we kind of forgot.
We did.
Anyway, feels like this changes everything, certainly for New South Wales.
Yep.
From expert opinions to in-depth analysis and reporting, the Project YouTube brings you the biggest stories from Australia and around the globe. Hit the subscribe button now for news delivered straight to your feed.